team and the mammographic machine. Our research has shown that the lack of access to mammographic equipment is a great hindrance to achieving the goal for early breast cancer detection. Morbidity and mortality of breast cancer. The mortality rate of death attributed to breast cancer is reducing in developed countries while rising in developing countries. The most common cause of death is cancer spreading to other organs, accounting for about 35 to 42% of deaths. The most common metastasis sites are the endocrine organs, the lungs, and the cardiovascular system. Robertson, 1989. In Nigerian women, the high mortality can be attributed to the high financial costs associated with late presentation. Olateju et al. 2016 observed that the mortality rate of metastatic breast cancer ranged from 10 to 15% in Nigeria, making breast cancer one of the most important causes of female deaths in Nigeria. The average estimated cost of treatment for metastatic breast cancer in Nigeria range from 150,000 to 400,000 naira per month. This amount is higher than the mean income of most working class women. To optimize our women's health, we must focus on early diagnosis and treatment as a strategy to achieve good quality of life and a 5-year survival at reasonable cost. Neuroimaging and cerebrovascular disease. Mr. Vice Chancellor, sir, my second area of focus is neuroimaging. The human brain is more complex than any other structure in the world. It is a marvel of creation. The brain consumes glucose and oxygen more than other structures in the body relative to its mass. Any drastic shortage of glucose and oxygen supply below a critical value can lead to irreversible injury to the brain. Stroke is a rapidly developing clinical sign of focal or global disturbance of cerebral functions lasting more than 24 hours or leading to death, with no apparent cause than vascular in origin. Mr. Vice Chancellor, sir, stroke is common in our society, affecting all ages, all age groups, including children and both genders. However, it is commoner in males and the elderly. The brain begins to die within minutes of the absence of blood supply. Therefore, early diagnosis is crucial. In the United States, stroke is the third leading cause of death. The warning signs of stroke include weakness on one side of the body, numbness of the face, sudden confusion, trouble speaking, visual problems, and dizziness. Africans are more prone to stroke compared to Caucasians, and cerebrovascular disease is a leading cause of morbidity and mortality in Nigeria, Owolabi et al. 2015. In many communities in Nigeria, stroke is shrouded in superstitious beliefs. Perceived causes of stroke among a subset of Nigeria include overloading the brain, spiritual battle, demonic attack, loneliness, and bitterness, Jerrich et al. 2018. In these communities, affected persons most often visit herbalists and spiritual houses rather than hospitals. These patients eventually come to the hospital when there is no improvement, and many come in a moribund state, making a positive outcome very difficult. In addition, many Yoruba communities, a man who develops stroke during sexual activity can be wrongly attributed to an occultic phenomenon called magun. Physiological risks for stroke, especially hypertension, others are high cholesterol levels, diabetes mellitus, smoking, and obesity. By appropriate lifestyle intervention, it is possible to reduce the risk of developing stroke in our environment. This includes monitoring blood sugar levels and blood pressure. In other words, stroke is preventable to a reasonable extent. The critical factor in the management of stroke is timely intervention. The early diagnosis and classification of stroke into hemorrhagic or ischemic is the basis of early intervention. Hemorrhagic stroke is sudden, usually fatal, and patients are managed conservatively or via interventional vascular procedure. However, ischemic stroke is technically more gradual, and early intervention can prevent major irreversible complications. Ischemic stroke depends on the size of vessels involved. If the vessels are large, it can lead to a sudden loss of consciousness. But if the vessels are small at times, the patient may be symptomless. Vascular intervention, either through radiological procedures or surgery, is appropriate for ischemic stroke, affecting the bigger vessels to prevent permanent disability. Non-contrast computerized axial tomography and magnetic resonance imaging (MRI) of the brain are the standard imaging modality for acute stroke evaluation. However, non-contrast computerized axial tomography (CT) is usually the first imaging modality for acute evaluation because it is relatively widely accessible compared to MRI. It is convenient and has a short imaging time and is sensitive for detection of bleeding. These imaging modalities are not readily available in most tertiary hospitals in Nigeria. For instance, in your state, for instance, we have most of these CT machines maybe in UCH, just one or two. And if you imagine the number of people that needs it, it tells you that we don't really have access to this modality. Therefore, these life-saving modalities are not accessible to the average Nigerian. In the Western world, suspected stroke victims usually present early, preventing extensive permanent damage. But in Africa, presentation is typically late. It may take weeks for suspected stroke patient to present at the hospital. A CT machine is a basic equipment in a 50-bed hospital in most developed countries, but it's still a luxury in Nigeria and out of reach of millions of people. Belotio et al., 2007, in a review of the first 100 cases, presenting a newly installed computerized tomography unit in Osogbo, Nigeria, showed that the most common request was for brain CT, and the most common finding was cerebrovascular disease. The human brain is complex, and each region has its specific roles and function. This complexity is responsible for the myriad presentation of stroke. In a local review of patients with clinical suspicion of stroke, computerized tomography correctly diagnosed about 75% of cases as stroke, and the rest were due to other pathologies masquerading as stroke. Furthermore, we were able to locate the region of the brain and match the symptoms with the area of injured brain. T.O. Bello Aremu, 2010. We also confirmed that ischemic stroke was more common in our environment than hemorrhagic. Okay? In Europe and America, ischemic stroke comprised about 70 to 85% of cases. Again, this has prognostic implication, as stated earlier, that ischemic strokes are usually less fatal than hemorrhagic stroke and more amenable to intervention. There's a diagram that showed the difference between ischemic and hemorrhagic stroke. Okay, this is an example. This is an hemorrhagic stroke showing you see blood within. Please, the other slide. Okay, you have the hemorrhagic stroke. Those areas that look dense and white are actually bleeding into the brain. And then the next one is the ischemic stroke. There you don't see much of bleeding into the brain, but what happens there is that the blood vessels get clogged and the brain dies a natural death. Mr. Acting Vice Chancellor, sir, stroke incidence is rising among young adults and is currently estimated to be about 20% of the total ischemic stroke. The reason for the increase are unknown, but it can be related to sedentary lifestyle, obesity, drugs, and hypertension. Young onset stroke have greater impact on life, and therefore its prevention is important. Unfortunately, in sub-Saharan Africa, relatively more younger age groups compared with developed economies are affected by stroke. In our work on stroke among young adults in Nigeria, Mustafa et al., 2012, we reviewed the admission of stroke over a 3-year period from 2009 to 2012 and observed that 12.9% of the admissions were young adults between the age of 27 and 45 years, and that hypertension was the main predisposing factor. Unfortunately, hemorrhagic CVD constituted about 50% of our cases, which is more challenging to manage successfully in our environment. In this study, only 3 had CT examination, and not within the first 24 hours of the incident. Consequently, These young adults develop multiple complications of the disease. Our study mortality rate was about 30%, which means that 1 in every 3 young adults with CVD died. The high death rate may be attributed to delay in diagnosis and failure to institute timely therapy. Another group at risk of stroke are young children with sickle cell disease. This group is highly predisposed to ischemic stroke of the major vessels. Nigeria has the highest bonding of sickle cell globally, and the incidence of stroke in this group of patients ranges between 65 to 70%, Lagunjo et al., 2011. Pediatric stroke leads to significant morbidity and mortality, and most of the stroke occur between the ages of 2 and 9 years. Now, this is very difficult because a child of less than 9 years having stroke will have various types of complaints, and it might be very difficult for even the doctors or the mother to know that this child is already having a problem. And this leads to learning disability, seizure disorder, and motor disability. Given the onset of impairment during childhood and the impact on quality of life, an institution of early therapy is the mainstay of management in the young adults and children. One way of doing this is by evaluating the extracranial section of the major vessels of the brain via duplex ultrasonography. Duplex ultrasound is a specialized interpretation of ultrasound waves. It refers to the utilization and application of ultrasound waves to interpret movement of blood within vessels and tissue. Duplex ultrasonography can quantify flow and is invaluable in the management of cardiovascular disease, especially in the assessment of the carotid arteries in suspected stroke patients. Bello T.O. et al. 2016, we established local values for the total cerebral blood flow in adult Nigerians indirectly by performing carotid and vertebral artery ultrasound. Accurate knowledge of the normal anatomy of the vessels and velocity of the blood flow to the brain helps in the management of cerebrovascular disease. For instance, if a patient has a narrowed and diseased carotid artery, the risk of developing ischemic stroke increases. Therefore, in such patients, it is imperative to start therapy before the onset of clinical symptoms. Bello T.O. 2016. In pediatric sickle cell patients, prevention of stroke is the hallmark of management. Again, ultrasound waves are used to interrogate the vessels to determine the normality and the flow of the blood and the velocity of the blood. Transcranial Doppler and transcranial color duplex Doppler are the imaging techniques for evaluating the major vessels in the brain. The two ultrasound-based methods can predict the probability of developing stroke and identify those with the highest risk of stroke. TCD is a non-imaging technique. It provides information in form of graphs. Whereas TCCD, you can identify vessels and take a more appropriate and accurate measurement. TCD was the method used for clinical trials and is currently the gold standard. Currently in Lautech Teaching Hospital, we created a neurologic clinic for sickle cell patients. The personnel comprised of a team of radiologists and pediatricians using transcranial color duplex Doppler to evaluate sickle cell children at risk of developing stroke. We perform this examination at no extra cost to these vulnerable patients as one of our major contributions to reduction of childhood stroke in our environment. As stated earlier, TCCD technique allows direct visualization of the arteries of the brain. We are currently working on the reliability of the TCCD compared with the established method of non-imaging TCD in Nigeria. The results are encouraging, and we have screened over 400 patients and have successfully identified patients at risk of developing